Anxiety disorders. This is very important topic. So many questions are asked. We can simplify by remembering few phrases. You will find that if you remember few phrases of a particular anxiety disorder, you will find the answer. So first question is asked, what is the difference between fear and anxiety? You all know anxiety symptoms. Yes, what are the anxiety symptoms? If you remember by head to toe, yes, dizziness or giddiness, yes, giddiness or dizziness, mydriasis, dilation of pupil, dryness of mouth, palpitation, breathlessness, chest pain, tremors, that abdomen, butterfly in abdomen or butterfly in stomach, butterfly in stomach, increased frequency of defecation and urination. So these are common symptoms of anxiety, and how you will differentiate anxiety from fear. If lion comes in front of you, you will have these symptoms again. So these symptoms will appear again. So how you will say these symptoms are for anxiety or for fear? A very important and simple difference is threat. It is a real threat or perceived threat. This question is asked frequently. Yes, suppose a lion comes in front of you, then he will eat you up. This is the real threat. There is a Hindi joke कि यदि तुम जंगल से जा रहे हो, शेर तुम्हारे सामने आ जाए, तुम क्या करोगे? तो उसने कहना मैंने क्या करना है, जो करना है शेर ने करना है, शेर ने खाना है तो खाना है. तो मीन्स lion, you all know, eats you up, kills you. So means that is real threat. But have you ever seen lizard eating a girl or cockroach eating a girl? Okay, you have never seen except in Men in Black. Okay, so but many times you must have seen in movies also that girl is afraid of cockroach. Means she is perceiving cockroach or lizard as a threat. That is perceived threat. So lizard is perceived threat. Okay, lion is real threat. So anxiety is having perceived threat. Fear symptoms may be same, but their reason may be different. Okay, now this is very important according to our preparation, how we can remain more fruitful in our preparation or in our exam. Yes, you must have a limited anxiety. We all know in physiology we have read Yerkes Dodson curve. Yerkes Dodson curve. What is Yerkes Dodson curve? Yes, in this, as arousal increases, performance is increased. At this side, yes, arousal. At this axis, performance. As arousal is increased, performance is increased. As this arousal goes beyond a point, then performance decreases. And at this point patient would present with anxiety symptoms. So we say a little bit arousal, a little bit concern towards study is good for our preparation. But if you have more and more anxiety symptoms, then your performance will decrease. So never ever be over anxious. Just remain cool and calm and prepare that by this way, and you will find the best performance and better result. So this is about Yerkes Dodson curve. In this, as arousal increases or anxiety symptoms may appear if more and more arousal is there. Yes, physio question. So as I told you, phrases are very important. Even a single phrase can tell you the answer. Whenever you find the question on generalized anxiety disorder, single liner also and clinical also, you will find the word or phrase free floating anxiety. So in any question, if you find this phrase free floating anxiety, without second thought, answer should be generalized anxiety disorder. What free floating anxiety means patient is anxious each and every time. When he is eating something, he is anxious. He is talking to somebody, he is anxious. He is catching bus, he is anxious. He is lying down, anxious, worrying about the next day plan, worrying about the office work, worried about the money. Means each and every time patient is worried or anxious. That is generalized anxiety disorder. If a person will remain anxious throughout the day for 6 months, for how much duration? 6 months. So duration criteria for generalized anxiety disorder is 6 months. All are questions, okay? Single liner, clinical also, they will give history and they will tell you that these symptoms are continuous for more than 6 months, 7 months, 8 months, like that. Okay. If a person would remain anxious throughout the day for a long time, then he will develop tiredness. Okay, he will develop, decreased concentration. He would be preoccupied with all thoughts. He would be always tensed. So we can remember these symptoms by a simple mnemonic watchers. So physical symptoms: W, worry, excessive worry. A, anxiety at all time. I just told you, generalized anxiety disorder: worry excessively, anxiety all time, tension, increase muscle tension. C for concentration, decrease concentration. If patient is so preoccupied with these thoughts, his concentration would decrease. Okay. Hyper arousal: after some time he would become irritable, he would remain irritable. Yes, so worried, so irritable. Low energy: all the energy will be exhausted, so patient will feel tired, low energy. Restlessness: worrying about so many things, so he would become restless. Decrease sleep: unable to initiate sleep. Sleep disturbance, you all know, depression, there is early morning awakening. Frequently asked question: in depression there is early morning awakening. Patient wake up 2 hours prior to normal awakening time, that is early morning awakening. Suppose previously patient used to wake up at 7, now wake up at 5. This question is asked, that is early morning awakening seen in depression. But in anxiety, when patient will lie down on the bed, he will think of next day's things. So he would not be able to initiate the sleep. He would remain lie on the bed for 10 minutes, 15 minutes, half an hour, 1 hour. So it is unable to initiate sleep. In depression, unable to maintain sleep. Okay. So although these are not so diagnostic, but on the basis of only one symptom you can't make diagnosis, but yes, these are found. So this is generalized anxiety disorder. In this, watchers is the mnemonic 6-month duration. Okay. Now a question, let me solve a question. A 35-year-old man comes to physician because of 7-month history of sleep disturbance. Duration criteria is fulfilled. Yes, let me tell you, this is a question, typical question of generalized anxiety disorder. Yes, now I am explaining symptoms of generalized anxiety disorder. Yes, in this question, 7-month history of sleep disturbance, restlessness. Yes, he has difficulty falling asleep, initiation of sleep, lie awake worrying about his family, next day meeting, finances, means excessive worry. Okay, or you can say free floating anxiety, you may use the word. He can no longer concentration is disturbed. Okay, he feels tense most of the days and avoids socializing with his friend. He appears anxious. Yes, physical examination shows no abnormalities. The physician recommends psychotherapy and medication. Yes, point it out: psychotherapy and medication. As you know, in anxiety disorders, best treatment is combination of, yes, best treatment is in anxiety disorder, you may write, in anxiety disorders, best treatment is psychotherapy plus SSRI, pharmacotherapy, SSRI. Okay, psychotherapy in this CBT. So all anxiety disorder, psychotherapy of choice is CBT except phobia, where behavior therapy. But you all know SSRI has side effect of sexual dysfunction. Sexual dysfunction. This is frequently asked question. That sexual dysfunction, SSRI side effect, that is delayed ejaculation. Delayed ejaculation. But this side effect can be used in premature ejaculation, is used in premature ejaculation. The treatment of premature ejaculation is SSRI, pharmacological treatment, currently commonly used, and latest approved drug is Depoxetine. Latest approved drug is Depoxetine. Yes, means this is short acting SSRI taken just before the sexual act, and it increases the ejaculation time. So this is use of sexual dysfunction, side effect of SSRI. Recently asked question and multiple time asked question, that SSRI without sexual side effect, antidepressant, not SSRI, antidepressant without sexual side effect are bupropion, agomelatine, mirtazapine. These three questions are asked, that these are having no sexual side effect. So other sexual side effect may be decreased libido, means sexual desire, erectile dysfunction may be there, but most important is sexual dysfunction, delayed ejaculation. So remember, whenever any patient having sexual dysfunction comes to you, means erectile dysfunction, decreased libido, any sexual side effect, if they give in question sexual side effect, then you will not give SSRI except premature ejaculation, for which we give SSRI as treatment. Got the point? Now, so again I repeat what I told you, all anxiety disorder best treatment is combination of CBT plus SSRI. But in phobia, behavior therapy plus SSRI. SSRI, never give SSRI in a patient if you find in question that there is sexual dysfunction, erectile dysfunction. Never ever give SSRI. Then you can use any other antidepressant in depression. This is antidepressant used in depression, not in anxiety. Not in anxiety. I have connected it to depression, but don't get confused. I have taken the side effect of SSRI. This is not related to the anxiety disorder. Okay, this is not related to anxiety disorder. This is separate thing. This is separate thing, so I have taken it separate. Okay, now I put a line so that you will remember this was discussion of depression, not anxiety. So what in anxiety? What in anxiety? Which drug you will use? Buspirone in anxiety. Yes, you will use Buspirone. So remember, why I discuss these things together, because many times both options are there, bupropion and buspirone. So they appear similar, and in exam we commit mistake. So this is buspirone, this is bupropion. In depression, you will use bupropion if sexual dysfunction. In GAD, just like generalized anxiety disorder or anxiety disorder, you will use Buspirone if sexual dysfunction. These two are frequently asked question and we are confused with similar names. Got the point? Okay. Now, yes, this physician recommend psychotherapy and medication. Psychotherapy, definitely you will prefer CBT. Medication, you should use SSRI. But in this patient, patient says that he is concerned about the side effect of psychiatric medication. He has struggled intermittently with erectile dysfunction in the past. So remember, erectile dysfunction I have already discussed. If erectile dysfunction is there, never ever use SSRI. Then which drug most appropriate for this? Yes, answer would be Buspirone. Answer would be Buspirone. Good. Answer would be Buspirone. Now, in the same question, yes, if I remove this line, many times I do like this. In most of the question I do like this. I have seen many times they give the same question and they modify a little bit. If I remove this line, these line, what should be the answer? Yes, little bit distress on your mind. Okay, what should be the answer? Yes, if I remove the history of sexual dysfunction, then what would be the answer of the same question? Yes, no history of sexual dysfunction, best drug is SSRI and escitalopram is SSRI. So now the answer would become escitalopram. Got the point? If no history of erectile dysfunction, the drug would be escitalopram or SSRI. Clear? So all anxiety disorders CBT plus SSRI except phobia behavior therapy plus SSRI. Clear? Now we come to panic attack, next anxiety disorder on which multiple time questions are asked. Panic attack. Suppose I am sitting teaching you. Suddenly I am teaching you normally. Okay, I am quite normal. Suddenly I develop anxiety symptoms, breathlessness, chest pain, perspiration, choking sensation. Yes, I am feeling that I might be having MI. Yes, definitely if a person is sitting quietly, 40 year, 45 year, or even young I have seen, but any patient who is sitting comfortably and suddenly get chest pain, breathlessness, choking sensation, yes, perspiration, he would think I might be having myocardial infarction, I might be having asthma, COPD. The concept is that patient would be preoccupied with the thought that I will die, I will die, I will go crazy. Yes, my doomsday has come. My doomsday, pralay ka din. Yes, I will not be able to survive. That is panic attack. Panic attack means sudden. Yes, I am sitting suddenly, out of blue, without any means previous indication, out of blue, spontaneous attack of anxiety. Suddenly I develop anxiety, feeling of impending doomsday. My doomsday has come. I will go crazy. I will die. I told you the phrases. So in any question, if you find my doomsday has come, I will go crazy, I will die, immediately you will think about panic attack. Okay, this anxiety build up in 5 to 15 minutes and subside. 5 minutes and it subside. Total duration is 5 to 15 minutes. Okay, 5 to 15 minutes means I will develop and after some time I would be okay. So in this patient usually think that he might be having MI, he might be having asthma, yes, might be having MI most commonly, and the clinician would also suspect the same. So all investigation should be done to rule out organicity. This is the fact. whenever you will find anxiety disorder, always not only anxiety disorder, in all psychiatric disorder, always rule out organicity or physical causes. So physical examination is very important in psychiatry. Just like you know that anxiety symptoms may present in hypertension. Suppose a patient comes to me having anxiety symptoms and I check the BP and I found that the patient is hypertensive. So better to give antihypertensive rather than giving anti-anxiety drug. Okay, so and when the BP will be settled, patient would be okay. This is the reason in question they have given that physical examination show no abnormality. So in panic attack, if panic attack every time, yes, you should rule out organicity. It may be heart attack, it may be COPD, it may be asthma. So this is question, what is the differential diagnosis? Differential diagnosis of panic attack means what you will suspect. If a panic attack patient comes to you, you will rule out myocardial infarction, COPD, asthma, mitral valve prolapse. These questions are frequently asked. Okay, now, so I have told you the symptoms of panic attack. If multiple panic attack, recurrent panic attack for more than 1 month, recurrent panic attack for more than 1 month, then it become panic disorder. Panic disorder. And a treatment, you all know the best treatment is combination of CBT plus SSRI. Clear? So this is panic attack. Phobia. What is phobia? Phobia is excessive and irrational. Excessive and irrational fear of things not feared by other. Not feared by others. Just like if a person is afraid of dog, another person don't. Yes, a person is afraid of height. Yes, other person don't. Means excessive. This should be very high, excessive and irrational fear. Okay, it may be social phobia, and the social phobia is also in DSM-5. The name is social anxiety disorder. Social anxiety disorder. I usually give an example and you will understand the question, that if a person is there, he is eating chow mein in a restaurant and he is not able to eat chow mein due to anxiety in that situation in restaurant. Okay, but the same person, same chow mein at home, he eats nicely. Means it is the situation, not the activity. Means the person is same, chow mein is same, but in restaurant, the social situation, he can't, but at home he can. So it is the situation, social situation in which patient become anxious, social anxiety disorder or social phobia. Okay, many times you will find the similar question that patient is having anxiety symptoms in a particular social situation, social phobia. What are specific phobia? Specific phobia, frequently single liner, and immediately you will find correct answer, and question are although now they are asking more and more clinical based question, but you can't ignore these because they can make a question on the single liner also. They can modify them clinically. Fear of darkness is called nyctophobia. I usually say nycto as night. In night there is darkness. Acrophobia, I usually remember acro, a crow, a crow. Crow flies on height. Crow flies on height. Okay, acrophobia. Cynophobia, C for canine. I do remember like this. You may make your own mnemonic. Yes, canine, C for canine. Okay, most common canine canine pet is dog. Okay, allurophobia, fear of cat. Mysophobia, dirt. Xenophobia, X. Yes, I was making a different mnemonic, but one student told me that, sir, we can remember is like that. Yes, sir, true life incidents happened to that student. Yes, sir. Yesterday I met my girlfriend. She was behaving just like stranger. X, behaving just like stranger. Thanatophobia, you all know Thanos. Yes, death, fear of death. Thanatology, forensic, you have read thanatology as study of death. Pyro, pyro is fire, pyro is fire, fear of fire. Agoraphobia, what is agoraphobia? Yes, agoraphobia means fear of those places, fear of those places from where escape is difficult. Yes, fear of those places from where escape is difficult. Remember this point. Why I am telling you? Because questions are asked in which they will confuse you between agoraphobia and claustrophobia. Yes, claustrophobia, fear of closed space, closed space or place, closed place. Okay, so in fear of those places from where escape is difficult include closed space, closed place, same. But other than that, patient would be fearful of market, fearful of means crowded places, fearful of open spaces, means agoraphobia is fear of those places from where escape is difficult. It may be market, it may be closed place, it may be open space. Open space, how can it possible? Yes, open space. You must have seen many Hindi movies. In the last, villain and hero says in the Registan, okay, the open area, yes, run wherever you can, and ultimately, so means in the open space there is no place to hide. Escape is difficult. So from where escape is difficult, agoraphobia. Yes, these patients are so fearful they will not travel alone. They will not travel alone. They, yes. So what you will say? You have fear of market, crowded place, open space, closed space, not traveling alone. Better to remain at home. Better to remain at home. So they are homebound. As I usually say, single word many times give you the answer. Yes, many times you will find that agoraphobia patients usually remain homebound. Okay, this is question. Yes, many time in clinical question you will find homebound, and it will indicate that you are going towards the diagnosis of agoraphobia. If you yes, Bengali, I am not so familiar with that, but at least थोड़ा सा पता है मुझे that ए तू घोर पे रहे, ए तू घोर पे रहे, घोर पे, घोरा घोर पे रहे, तो घर means homebound. Okay, you may remember like that, and you can easily remember if only fear of closed places, claustrophobia. If other points are also given, agoraphobia. And this is a very frequent question, that agoraphobia and panic attack are comorbid. What does it mean? We found that many patients of agoraphobia also have panic attack, panic disorder, or many patients of panic attack or panic disorder may have agoraphobia. Now, This question: 25-year-old man comes to emergency department with palpitation, sweating, shortness of breath that begins 10 minutes ago. He says, please help me. I don't want to die. Yes, I will die. I will go crazy. My doomsday has come. Yes, indicating towards panic disorder or panic attack. He has experienced several similar episodes over past 2 months, more than 1 month panic disorder. Okay, which occurred without warning the in situation, including open space, crowds, and resolve gradually after 10 to 20 minutes. He has been staying at home as much as possible out of fear of triggering another episode. So, homebound means I told you panic attack is commonly associated with agoraphobia, comorbid agoraphobia. Okay, his pulse. So, in clinical questions, many times they will not fulfill the criteria of a particular disorder, but they will indicate. Okay, and you will make the diagnosis on the basis of your basic knowledge or basic concepts. Okay, his pulse is 104. Why we are taking pulse? I told you that every time panic attack would be there, you will rule out myocardial infarction. It may be asthma, it may be COPD, mitral valve prolapse, it may be anemia, it may be pheochromocytoma. So many disorders which may present with the symptoms of panic attack. So you will rule out by checking respiration rate, respiratory rate, blood pressure. All these things are normal, and you did cardiopulmonary examination to rule out other differential diagnosis of panic disorder. So no abnormality. EEG shows sinus tachycardia. It's benign. Which of the following is most appropriate initial action taken by physician? So whenever this type of question is asked, yes, all the clinical examination is normal, means now you are thinking about psychiatric disorder. And in psychiatric disorder, immediately what can give benefit? Yes, immediately you will give benzodiazepine. Immediately benzodiazepine. Wherever initial treatment or immediate treatment, you may find the answer benzodiazepine most of time. But whenever the treatment of choice, you will say CBT plus SSRI. Okay, so benzodiazepine is not a treatment of choice. Okay, that is only initial treatment. So let me discuss few points about treatment of phobia. Questions are asked. As I told you, phobia treated by behavior therapy. All other anxiety disorder by cognitive behavior therapy, but phobia by behavior therapy. What is behavior therapy for what are behavior therapy for phobia? First is graded exposure. Suppose a patient comes to me and he is having cynophobia. Cynophobia means fear of dog, and I want to do behavior therapy graded exposure. Means I will expose the patient to dog gradually. Gradually means I will make a hierarchy of exposure. What I said? Hierarchy of exposure. What is hierarchy of exposure? Means patient would come to me. First day I will show him photo of dog, and the person who is having phobia of dog, he would become fearful of that photo only. He will develop so much of anxiety. We will not do anything. Okay, after some time this anxiety will resolve spontaneously. Next time he will come again. Yes, he will come again. I will show him movie of first I showed photo of dog, movie, entertainment, movie of dog. Then yes, after yes, when he will see movie of dog, he would become fearful. Then I will, next time he would come to me, I will expose the patient with a little bit higher exposure. Then I will show him real dog from distance. Look at this, that is the dog. Then next sitting he would come, will show that this is the dog. near, dog from distance, dog from near, and then ultimately will come touch the dog. So we are exposing the patient gradually. Gradual exposure, yes, means photo of dog, movie of dog, dog from distance, dog from near, touch the dog, and the patient would be treated. This is graded exposure. Hierarchy of exposure. What is about systemic desensitization? Systemic desensitization, now patient comes to me. He is fearful of dog or aeroplane and he says, yes, treat me. I said, okay, don't worry, I will treat you. But what you did, you trained the patient in relaxation exercise, do deep breathing exercise or other relaxation exercise. Yes, when patient comes to me, I ask the patient to do deep breathing exercise or relaxation exercise. When patient is in relaxed state, I will expose the patient to the phobic stimulus. Means I would say relax, do deep breathing. Now think of aeroplane. When he will think of aeroplane, merely thinking of aeroplane will develop anxiety. But we found that when phobic stimulus means aeroplane, thinking of aeroplane, thought of aeroplane is given in relaxed state, that will develop less anxiety. That is called reciprocal inhibition. That is called reciprocal inhibition. What does it mean? Means if phobic stimulus is given in relaxed state, it produces less anxiety. Okay, less anxiety. This is reciprocal inhibition. This question is asked. So in systemic desensitization and graded exposure, if I ask you one very important difference, in graded exposure there was no relaxation exercise. In systemic desensitization there is a relaxation exercise. What is flooding? A very rich person comes to you, say, Doctor, I am fearful of dog, but I don't have time. Yes, take money, whatever you want, but treat me. You would say, okay, don't worry. You close the patient in a room having 10, 12 dogs. Yes, in a room having 10, 12 dogs. Now, if patient survived, he will never be fearful of dog. That is called flooding. Flooding means you give supramaximal stimulus. 10, 12 dog, supramaximal stimulus. Supramaximal stimulus. Okay, so if he survived, he will never be fearful of dog. Yes, this is aversion therapy. Aversion, type of aversion therapy, type of therapy. What is participant modeling? Yes, in this the psychiatrist or the counselor will show that this is the puppy or this is a dog. He would touch the dog, he will keep the dog in his lap and would show that if it is not harming me, how can it harm you? So this is participant modeling. Okay. So these are behavior therapy for phobia. So I told you that all anxiety disorder best treatment is CBT plus SSRI plus, but phobia behavior therapy plus SSRI. A question was asked, selective mutism. Selective mutism. The name itself tells you what is selective mutism. Selective means selected situation. Mute means silent, not speaking. Patient, yes, in this patient is mute. Patient is mute. You all know what does mute mean. Not speaking. Not speaking. In selective situation. In selective situations, just like school. So if a patient comes to you, a child comes to you, is not speaking in the school, immediately you will think that he might not be or she might not be knowing the answer of the question. If not giving the answer of question in school, so you may think that she might not having read that topic, that not she is not having information about the topic, that's why she is unable to speak. But we found that she is having adequate knowledge, adequate knowledge of topic. Yes, there may be, yes, you thought there may be a problem in the communication, means she is not able to understand the language in which you are asking, but she is familiar or he is familiar with the patient is familiar with the language. Yes, patient understand the language. If these symptoms are for 1 month, then what will happen? The teacher will start thinking that this child is not sincere about the study. Yes, buddhu bachcha hai, like that. So his or her patient's academic performance would decrease. Academic performance would decrease. Academic performance would decrease. Yes. So this is about selective mutism. Now solve this question. A 5-year-old boy is brought to your office by his parents, who says that he has not been speaking at school for last several months, means more than 1 month. Duration criteria is fulfilled. The parents are concerned because this has impacted the patient's academic performance. Patient's academic performance is affected. They are perplexed these symptoms because when patient is at home with them, he is quite talkative, means patient is mute in selected situation. Which of the following is the most likely diagnosis? The answer is selective mutism. Okay, you can easily mark other answer as wrong if I discuss one by one. Avoidant personality disorder. Personality is formed in adolescence. Question is asked. Personality formed in adolescence and matures around 40 years. So in a child having, yes, a child of 5 year has not developed personality till now. So you can't make diagnosis of personality disorder in children. Remember this point. Okay, personality disorder you can't make as diagnosis at the age of 5. Post traumatic stress disorder, PTSD. There is no history in this question given traumatic event. No traumatic event, no objective stressor is there, no bomb blast is there, no road traffic accident. Why I'm telling you like this? Because many time in PTSD you will find history of trauma. Accident means accident, road traffic accident, RTA. Sometimes you will find bomb blast. Sometimes you will find rape, earthquake, flood. So in PTSD you will easily make the diagnosis by the first thing by stressor. Second, typical symptom in PTSD you will find flashback, nightmares. Yes, flashback, nightmares. Okay, you may find arousal symptoms, irritability. You may find Yes, means if a patient is exposed to bomb blast, suppose a person is yes, I usually say is let me discuss the PTSD at the same time because it's a very productive question. Many times you will find question on this. Yes, PTSD. What is PTSD? Post traumatic stress disorder. In this, I give example. Suppose there is a person who bought a new car. Yes, bought a new car. Yes, he took all family member in this car, go to temple. As reached to temple, he came out of the car, bomb blast. All family member died. All family member died in front of his eyes. Means this is very traumatic event. This is very traumatic event. Okay, bomb blast. All family member died. Okay, very big stressor. After this bomb blast, he started nightmare. Yes, dreams of same event. Flashback, he's sitting. Immediately the same scene comes in front of his eyes or mind. That is flashback. Irritability, decreased sleep, avoidance symptom. What are avoidance symptom? Now he never go to temple. He never go to temple. He never drive car. He never go to that place. So he avoid that place, avoidance. So if typical symptoms are there and these symptoms are more than 1 month, then it is PTSD. If these symptoms are less than 1 month, then you will not make diagnosis of PTSD. The diagnosis would be acute stress disorder. Remember this point. These symptoms less than 1 month, acute stress disorder more than 1 month, PTSD. So this is PTSD. You can exclude the diagnosis by typical symptoms of PTSD. In this answer is selective mutism. What is autism spectrum disorder? Autism spectrum disorder. Yes, previously ICD 10. Yes, you must know ICD 10, the name was given pervasive developmental disorder. But DSM 5 and ICD 11, they have changed the name to autism spectrum disorder. Now previously pervasive developmental disorder include autism, Asperger syndrome, Rett syndrome and Haller syndrome, but now they DSM 5 and ICD 11 has resolved this classification and they have joined all these disorder in one roof, under one roof, that is autism spectrum disorder. What does it mean? Means previously we used to say if you want to make autism diagnosis of autism, you must have 3 criteria. Yes, this is the old thing. Autism, yes, you must know autism 3 criteria. One is no social interaction. No social interaction means social development is lacking. Yes, no social interaction, no eye to eye contact, no social smile, no stranger anxiety. So one component is social development is impaired. Second is stereotypic stereotypic behavior. Yes, you must have seen it. Suppose the autistic child is sitting and doing like this. Mean not making eye to eye contact, no communication, no eye to eye contact, no social smile, and this is a stereotypic movement. What is stereotypic? Repetitive, yes, purposeless, odd movement. Okay, this is I gave you stereotypic motor movement. Sometimes you will find that stereotypic behavior, the patient is means doing the same behavior again. He would choose a particular path to go to school and he would be stick to that path. He plays toys or certain specific toys, yes, or 5 red toys, 3 red toys, means patient is having a fixed behavior, stereotypic behavior. Okay, second criteria. Third criteria is language. Language development. Patient, normally a child or infant, 6 month la pa ma ba da monosyllable, 9 month bisyllable, but this child will not develop language. So previously we used to say this is autism, and we used to say if language is normal, then Asperger syndrome. Asperger syndrome. If language is normal, language is normal. Clear? So we used to say Asperger syndrome is nothing but autism minus language disturbance. Okay, so if language is normal and initial 2 symptoms are there, then Asperger. If language is also affected, autism. But now according to DSM-5 and ICD-11, they have removed this language criteria. Now if I say autism only having these 2 symptoms and Asperger these 2 symptoms, yes, so there is no difference between autism and Asperger. This was the purpose. DSM-5 and ICD-11 said that when these 2 disorders are quite similar, only difference is language. I did not discuss about Heller syndrome, but leave that for the time being. So autism and Asperger syndrome, when these are having similar symptoms, why do classify them separately? So they are included, all these are included in, yes, autism spectrum disorder, new name. Okay, so now this termination or this nomenclature of autism and Asperger syndrome is removed, and now the common name of these disorder is autism spectrum disorder. Clear? So this is about different options. So it can't be autism spectrum disorder, it can't be PTSD, it can't be avoidant personality disorder. As I told you, personality disorder diagnosis never made in children. In the same way, if personality disorder question is asked and if a patient comes to you, that patient is suspicious over family member for 1 year, for how much duration? 1 year, and the age of patient is 35. So symptoms started at the age of 34. Symptoms are for 1 year. Symptoms are for 1 year and started at the age of 35, 34, and patient came to you at 35. And now they ask what is the diagnosis? It, yes, suspiciousness. Whenever you will find suspiciousness, immediately you will think of, yes, suspiciousness. It may be paranoid personality. Yes, you must have read paranoid personality disorder. So you may think of paranoid personality disorder. They will give clinical symptom in such a way, such a nice way, that immediately you will start thinking of paranoid personality disorder. But it can't be paranoid personality disorder, because personality is formed in adolescence. Means these symptoms should start during the adolescent. But in this question I told you 35-year age, symptoms for last 1 year, means symptoms started at the age of 34. This can't be personality disorder. Remember this important point. Age is very important in personality disorder, or onset of symptoms, or age of symptom onset is very important. A question was asked in INICET, single liner was there but can't be avoided, that which anxiety disorder is comorbid with selective mutism. We found that the children having selective mutism have other comorbid anxiety disorders. Most common, what does it mean? Means patient came to me, he's having or she is having selective mutism, he or she is also having social anxiety disorder, social anxiety disorder, or another name is social phobia, social phobia. So means selective mutism patients are usually comorbid with social phobia or social anxiety disorder. Means you can make two diagnoses, one is selective mutism, one is social anxiety disorder. So I have tried to touch most of the aspect of anxiety disorders. So if you revise this and you remember the phrases just like free floating anxiety, just like my doomsday has come, I will die, I will go crazy, panic attack, okay. Phobia you can easily remember by the mnemonic a crow, crow fly on height, yes, X behave like stranger. This is very important. Agoraphobia, claustrophobia, you must differentiate, yes. And these agoraphobia, many times you make the diagnosis by word homebound. In all anxiety disorder, treatment is CBT plus SSRI, but phobia BT plus SSRI. Initial treatment you will think of benzodiazepine, but treatment of choice is CBT plus SSRI. This difference is very important. Bupropion, if side sexual dysfunction is there, patient is depression, you will prefer bupropion, and if anxiety patient and having sexual dysfunction, answer would be Buspirone, okay. These questions are asked on the behavior therapy or phobia, selective mutism, recently asked topic, and I have touched few important topic of PTSD, personality few aspects, age is very important, personality disorder, and autism spectrum disorder. So thank you.